Good afternoon, everyone. Welcome to Magnetic Resonance Imaging, a comparison with other imaging modalities in radiology. My name is Leo Junmal, and I'm excited to be your instructor for this MR imaging course. In this presentation, we'll briefly discuss the advantages and disadvantages of MR imaging in comparison with the two other radiological modalities, CAT scan and X ray, to be specific. Let's start with advantages. All clinical diagnostic images must demonstrate contrast between normal anatomical features and between anatomy and any pathology. Simply put, image contrast is the ability to distinguish between two or more structures. In MRI, contrast refers to the ability to demonstrate differences in tissues. If there is no contrast difference, it is impossible to detect abnormalities within the body, actually. So, having said that, one of the main advantages of MRI compared with other imaging modalities is the excellent soft tissue discrimination of the images. The contrast characteristics of each image depend on many variables, and it is important that the mechanisms that affect image contrast in MRI are understood at least at a basic level. Just a side note, you need to learn the definitions to pass the MR registry and not um, fully and completely uh, know the concepts of MRI physics. Now, don't get me wrong, of course, you have to learn and grasp the technical aspects, including equipment, personal, colleague, and patient safety, as well as patient care concepts in MRI. It's just that I want you to stay relaxed in regards to physics involved with the MR imaging throughout this course. So, getting back to the image contrast in MRI, which we will explore further in greater detail in future modules. In essence, magnetic resonance imaging provides exceptional soft tissue detail, and that's the very reason it has become the modality of choice for imaging the central nervous system, joints, specific organs like heart, liver, kidneys, musculature, and other soft tissue structures. Okay, moving forward, MRI is a non ionizing radiation imaging modality. So, what does that mean? You probably recall from high school or X ray physics that in a stable atom, the number of negatively charged electrons equals the number of positively charged protons. Atoms with the deficit or excess number of electrons are called ions, and the process of removing electrons from the atom is called ionization. So, ionizing radiation can affect living organisms. Ionizing radiation is the most harmful because it can ionize molecules or break chemical bonds, which basically damage the molecule and causes malfunctions in cell processes. So, ionizing radiation is the type of radiation basically that we use for CAT scan and in X ray imaging. But MRI does not utilize ionizing radiation for image production. We use radio waves and strong magnetic fields. So longer wavelengths are used, and lower frequency waves such as heat and radio are some of the examples that have less energy than a shorter wavelength or higher frequency waves like in X-rays or gamma rays. So not all of the electromagnetic radiation is ionizing. Only the high frequency portion of the electromagnetic spectrum, which includes X rays and gamma rays, is ionizing. So basically, ionizing radiation is radiation with enough energy that to remove tightly bound that basically removes tightly bound electrons from the orbit of an atom, causing that atom to become charged or ionized with the ionizing radiation that can alter our DNA. And there comes in the advantage of MRI when its non-ionizing radiation capabilities supersede the other two diagnostic imaging modalities, because X-rays and CT utilize ionizing radiation to obtain images. So it's one of the great advantages of using MRI over other modalities. All right, in this slide, we see the orthogonal plane. So, orthogonal simply means 90 degrees from each other. So, two lines or planes are orthogonal if they are at right angles to each other, like 90 degrees to each other. In MRI, we have the ability to capture images in axial, coronal, and sagittal planes compared to the other two modalities. Like X-ray, we obtain the image in one plane, and then we have to reposition the patient to get a sagittal view, like in chest X-ray. But in CAT scan, although we can get transverse like or axial imaging, but we have to reconstruct them in other planes like coronal views or coronal planes or sagittal planes by a process known as MPR, which stands for multiplanar reformation. So MPR. But initially, we are getting axial images in CT also. So in MRI, we can start imaging in any of the three planes, sagittal, coronal, or even axial as our initial imaging. We can actually obtain oblique or oblique slices, however you want to pronounce that. We use those oblique slices for orientation or localization of anatomy being scanned for further imaging. So MRI is great for the three orthogonal plane imaging. All right, let's go to the next slide. What do we have here? Okay, in this slide, we see different combination of MRI and other modalities like PET MRI, which is fundamentally part of nuclear medicine. A PET MRI is basically a powerful diagnostic imaging tool that combines the metabolic information provided by positron emission tomography. PET stands for positron emission tomography. So, it's very detailed and it's high resolution images produced by the combination of magnetic resonance imaging and PET scanning. And these high quality images of MRI with the metabolic details collected by PET scans, and they pinpoint the exact location of tumors in cancer patients. So this capability of PET MRI combination makes it ideal for staging of tumors and pre-surgical planning in our cancer patients. So very useful. And then we have ultrasound MRI is it's another useful combination for various diagnosis and it's becoming more common in hospitals for biopsies and surgical interventions. Then we have this interventional MRI. Interventional MRI can be used for a variety of specialized procedures. Um, these systems are often used for doing biopsies of lesions, resections of tumors, guiding thermal ablation of tissues, as well as other procedures. It is commonly used in neurosurgery, though, where every millimeter of tissue spared in surgery can make a difference for patient recovery. So we can note that MR technology combined with other modalities is a great tool in diagnostic imaging. So several years ago, in the year 99, when I started my journey in radiology, there was extensive research and talks of portable MRI in the healthcare diagnostic imaging community. Now, 20 plus years later, there is portable technology available in MRI. You see that in the picture here. Hyperfine designed the swoop system to address the limitations of current imaging technologies and make MR imaging accessible nearly anytime and anywhere in a hospital setting. So this MRI portable system drives directly to a patient's bedside. From what I understand, I haven't seen it yet in person, and from what I read about it, it plugs into a standard electrical outlet and is controlled by an Apple iPad. I mean, it's ready to scan in less than 3 minutes, and then the system enables mm, care decisions without patient transport to MRI suite. So you don't have to take the patient to the magnet, but the magnet itself reaches the patient and is ready to image. So the Swoop portable MR imaging system is the first portable MRI device cleared by FDA, the Food and Drug Administration. So the portable device was specially this portable device was specially designed to still take advantage of the powerful soft tissue imaging properties provided by the magnetic fields of fixed MRI. So this technological advent, MR imaging portability, is um, workable in environments like the ICU and ED, emergency department, where patients are often intubated, connected to life support equipment, and otherwise surrounded by metal objects. So, overall, a great advancement in imaging technology, considering the limitations of metal and magnet interaction and safety issues that we will discuss in the future modules as well too. Okay, moving forward, um, let's discuss MRI contrast briefly. I'll upload material on MRI IV contrast in coming weeks for your review, but gadolinium contrast appears to be an effective agent for MR imaging. This contrast is basically consisted of magnetic molecules that are suspended in clear solution, and it goes through the patient's vessels or bloodstream and gets processed in the kidneys, and within 24 to 48 hours gets out of the system through urinary tract. Compared to iodinated contrast, which is used in CAT scan mostly, gadolinium contrast is associated with the significantly lower incidence of contrast and like nephropathy and early progression to end stage renal disease. Also, its ESRD is end stage renal disease in patients with pre-existing chronic kidney disease. So overall, gadolinium contrast has less reactions, close to less than 1% than compared to iodine contrast in CAT scan. Right. Another great advantage here of MRI is that without introducing IV contrast like gadolinium that we use in MRI in the biological tissue, we can still visualize arterial and venous system like circle of Wilson brain, aorta in the chest, and abdominal cavities, and carotid arteries that carry blood into the brain. We can run time of flight sequences, TOF, time of flight sequences, without injecting the patient to see the vascular structures in MRI. And please don't worry about the unfamiliar terminologies such as time of flight, TOF sequences. We'll cover these in the flow phenomenon and MR imaging in future modules. Okay, let's discuss some limitations and disadvantages of MR modality compared to CAT scan and X-rays or radiology in general. The first one in the list is the increased temperature of the patient due to RF pulses in MRI. Although compared to CT and X-ray, there is no ionizing radiation involved with MRI as we discussed earlier, but there are risks associated with the time varying RF field. Heating and burns can occur because heating is produced on tissue near the RF transmitter and within tissues due to resistive processes within the patient. So what happens is that when radio frequency pulses are introduced to the patient's body, the molecules start to gain energy and heat is generated. And the byproduct of magnetism is heat. So and it takes a little bit of time for the patient to dissipate that heat energy. So by adding RF pulses to the body, we are increasing the overall temperature of the patient's body. And increasing SAR basically means increasing the temperature limit for the biological specimen or tissue, basically by introducing the RF pulses to the patient during the MR scan. SAR stands for standard absorption rate. So this topic will be discussed in our safety modules, but remember that byproduct of magnetism and radiofrequency pulses, RF pulses, is heat. So that's a disadvantage in MR imaging, and as MR technologists, we are to be aware of the SAR limits and standards when scanning our patients. All right, moving forward. All right, so disadvantage, I'm sure everyone's have heard of the knocking noises, closed in claustrophobic feelings. So starting with claustrophobia, claustrophobia can cause the patient to deter and decline MRI imaging actually, and the confining nature of the MRI apparatus can lead to patient feeling closed in during their MRI. And sometimes talking to friends who had prior experience with MRI could scare the patients as well. And then we have these loud banging noises during MR imaging. Some people relate to them as jackhammer noises at a construction site, or some say broken washing machine. These noises are due to the gradients, which are crucial for spatially encoding the data, or MR signal or MR echo, but they are very loud and very noisy. Due to Lorentz forces of gradient coils, MR imaging is loud and can be very uncomfortable for the patient. So MRI technologists are to give earplugs and provide headphones for music to eliminate some of the noise during the MRI exams. This Lorentz force are also known, they're known as electromagnetic force. It's a combination of electric and magnetic force on a point charge due to electromagnetic fields. We'll cover Lorentz force in the safety module as well. So, confined configuration of the MR magnet and the loud noises are essentially one of the biggest reasons for patients being uncomfortable in MRI environment. Among the most common complaint is the MRI scan timing compared to X-ray and CAT scan, where the exams can be finished in minutes. MR imaging takes a lot longer. Once you start your clinical, or you probably, most of you probably are scheduled to go to clinical sites, you'll soon find out that most of the MRI sequences are lengthy. Patient motion during the MR imaging is very detrimental since each sequence of a scan can be 4 to 5 minutes long, and often the protocols required for diagnostic MR imaging are lengthy, like 30 to 45 minutes, which can compromise the quality of imaging in MRI due to patients' movement and their discomfort and change in positioning. So, timing of the MR scans can be a disadvantage, and as MR technologists, we continuously fight the battle to reduce MR scan times without compromising the image quality, of course. Magnetic device, electrodes, and or metallic implants are a great challenge within the MR environment. Due to the nature of strong static magnetic field and resulting ferromagnetic interactions, an object or device may be moved, like or rotated, dislodged, or even accelerated toward the magnet. Not everyone is a candidate to get MRI exam due to unsafe devices like pacemakers, aneurysm clips, neurostimulators, and certain types of shunts. So, as MR technologists, again, we have to follow strict guidelines for MR safety, and of course, we will discuss that in much greater detail in MR, both in MR patient care and MR safety modules. Okay, nitrogen and or liquid helium is used as a cryogen to reduce the resistance on the MRI units or magnets. The superconducting magnet should always be at a certain temperature to remain safe and effective. So we'll learn more about various types of magnets and instrumentation module, but for right now, remember that liquid helium is considered to be the best element for achieving a cool superconducting magnet. And liquid helium is expensive, approximately $20 to $30 per liter. It is recommended by most of the vendors like Siemens and GE and Philips to refill MRI machine with liquid helium before it goes below 65%. So all machines have different liquid helium capacities of up to 18,000 liters. If during a quench these cryogens are unable to vent out, there are a lot of safety issues that need to be dealt with. So this again will we'll further explore in MRI safety related topics and presentations in the future modules. All right, okay. So lastly, MRI exams are costly compared to X-ray and CAT scan imaging, roughly 3,000 to 4,000 if paid out of pocket without insurance. So the cost of MRI exam can be a deterrent for the patient to not get the MRI. All right, these were the advantages and disadvantages for the MR imaging compared to X-ray and CAT scan modalities. If any questions, you can contact me via email, and I'll be happy to answer. Thanks all for your time, and bye for now.